Okay, so let's dig into this quite chilling, sort of different type of ransomware attack now. So I'm going to talk about this attack where the cyber criminals have gone after, basically extorted patients directly. So back in October of 2020, there was a psychotherapy center in Finland, and they became a target of this type of a double extortion ransomware attack where they stole the clinic information and then basically demanded a payment of 40 Bitcoin, which is about half a million euros at the time. And in return, they promised that they wouldn't publish these therapy notes, which of course are extremely sensitive and have all of the deepest, darkest details about individuals. And what they said was that they were going to start to publish them 100 patient records at a time, every 24 hours. Now, Vastaamo, the clinic, declined to pay. And so this bad guy called Ransom Man, he really shifted his tactic and decided, okay, I'm going to extort these individual patients directly. And according to the Finnish police, around 22,000 victims reported extortion attempts that had targeted them directly, personally, with targeted emails that threatened to publish their therapy notes online unless they, as individuals, paid about 500 euro for the ransom. Now, this is terrible stuff, right? The clinic had exposed the data. They had vulnerabilities in their systems, and it's one of the largest psychotherapy providers in the country. They left the records vulnerable, and there was basically a series of targeted extortions that really sent a shockwave through the country. Now, so this disturbing twist, right? What made this case particularly disturbing really is this attacker strategy post breach. So instead of just simply continuing to demand the ransom from the clinic, the idea that they go directly to the patients is pretty brazen. And you can imagine receiving an email that you're deeply personal therapy sessions, notes that could be including, sort of your darkest fears or struggles, would be exposed unless you paid up. And I think, many patients face this unimaginable pressure. Some paid the ransom out of fear and anxiety. But the emotional toll of this kind of extortion really can't be understated. And this really has marked a new and very ruthless phase of cybercrime. And the tactic of targeting patients directly is extremely effective because the attacker is preying on each individual's personal fears and concerns. And really, by exploiting the intimate details of therapy sessions, the hacker was able to terrorize victims in a way that general financial or regular run of the mill data breaches can't do. So the damage really went way beyond financial losses. It shattered the trust and it really caused irreparable harm, further harm to the patient's mental health. So here's a question. Could this happen to dental practices? Well, really, absolutely. At first glance, a dental practice might not seem like a target for this type of attacks. Dentists just take care of people's teeth, right? But the reality is that dental records contain really a wealth of sensitive information, from medical histories to detailed records of medications, allergies, even psychological health concerns, particularly for patients who may have had medical or anxiety issues regarding treatments. And then we also store quite a bit of financial information, people's credit cards, and so on. So, this type of breach, and it's common that these bad guys go after these smaller clinics because they know they don't have big budgets to put big cybersecurity programs in place. They know that there's a shortage of cybersecurity professionals that actually work in the smaller healthcare practices, and they also know that dental practices and other medical type fee for service clinics are not keeping up with the type of training that they need to have in order to circumvent these types of attacks. So there's really some key lessons to learn here. And I think it comes down to, some of the stuff that we've talked about many times here at Myla. There's key lessons. Data encryption is a must. Really prompt responses to the breaches. The delays in responding to and disclosing the breach can compound the damage. Dentists and healthcare professionals must have a clear incident response plan. This includes notifying affected individuals immediately. Strong authentication and access controls. What does that mean? We need to know how and who can have access, and make sure this is locked down. Having that two-step verification or two-step login in place. Making sure we do regular security audits so that we can find these weaknesses. This breach exploited long-standing weaknesses in these systems, and regular security assessments could identify and address these types of vulnerabilities before they can be used against you. And then also for in any case, regardless of whether you're trying to protect yourself from data loss through a cyber attack, or what even happens more commonly, like server failures, you gotta have a backup and disaster recovery plan and some good tools in place for that. And so, patient trust is always on the table. Make sure that you're taking a look at these types of steps. Get that security risk assessment. I'm here for you if you want to reach out, book a free consult, but stay safe out there.